We have a very interesting session this morning. I'm very excited to introduce JoDee Winter. She is the physician assistant with the Department of Neurosurgery at Mayo Clinic in Arizona. I've come to know JoDee during my time at Mayo in my fellowship, and I got to see firsthand her dedication to patient care and to education at the same time. So it's a really exciting time to have you with us today. JoDee serves as the program director for the Neurosurgery Physician Assistant Fellowship at Mayo. I believe it was the first, JoDee will correct me if I'm wrong, but I think it still is probably the only one currently around the country that does specifically for neurosurgery PAs. She also is the assistant professor at the Mayo Clinic, and she is the president-elect for the Association of Neurosurgical Physician Assistants. She serves on the education committee as the education committee chair in the ANSPA, again, highlighting her commitment to education. Her medical career started as a radiology technologist and then sonographer, and then slowly, as her interest grew in patient care, it led her to a PA career where she did other surgical specialties in vascular, cardiothoracic, and transplant before she saw the light and came to neurosurgery, and where she still is now. She is highly involved in education of APPs, precepting, and medical research, as well as writing. JoDee, it's a pleasure to have you today. Looking forward to your talk.
Thank you. Good morning. Let me share my screen and just make sure everybody this works. All right. Can you see my screen?
Yes, we can see your screen.
Okay. And where'd it go? Okay. Can you see my notes or not my notes?
No, we just see your the slides.
Perfect. All right. Well, good morning, everyone. Thank you so much for this opportunity. I appreciate all of you this morning joining us. I am going to talk today about a topic that's very near and dear to my heart, our Neurosurgery PA Fellowship here at Mayo Clinic, Arizona. I have nothing to disclose. All right, a little background. The fellowship started in September of 2018 and was the first and remains the only neurosurgery PA fellowship in the country. There are a couple I've heard that are trying to open one, and I think one is accepting applications, but we're the only one so far. We take one fellow per year, and it runs from October to October. So the application cycle normally starts in November, and it runs through the end of April. Our goal at the end is to have a very well-trained neurosurgery PA who can then be ready to join a practice and expand their knowledge to others. Interviews are usually conducted in May and June. Our fellows usually selected by July. That's our goal. And then the fellows are paid a stipend every year. They don't get a salary. They don't get a full salary, but it is a stipend. The annual salary is $77,000 a year. And it has been increased each year recently in order to help make the fellowships much more lucrative and prosperous to new PA graduates. This is our current faculty and our fellow. I am the program director. My assistant program director is Catherine Katie Anastasi. Serena Garcia is our current fellow. Dr. Bernard Bendock is our chair of the Department of Neurosurgery at Mayo Clinic, Arizona, and serves as our medical director. And then Dr. Chandan Krishna is the vice chair of education for Mayo Clinic, Arizona in the Department of Neurosurgery. So we do many rotations throughout the fellowship. The first week usually consists of hospital orientation, computer training, all of that kind of fun stuff. And then the next week we do what's called a fellow neurosurgery boot camp. And I'll talk a little bit more about that later. We do offer rotations in physical medicine and rehab, in the pain clinic. As you all know, we do a lot of pain patients in neurosurgery, so it's kind of nice to have that background. We also do a neuroradiology rotation in order at the very beginning of the fellowship in order to get people familiar with looking at MRIs, looking at CT scans, and kind of making a diagnosis based on imaging. Our fellows also rotate through neurology and through stroke neurology. We are a comprehensive stroke center here at Mayo AZ, and it's a great opportunity for them to kind of see how stroke care starts from beginning to end. We send our fellows through the ICU for a couple of weeks here at Mayo Clinic, Arizona. And then we don't have pediatrics here, so we have to send them to our local children's hospital, which is Phoenix Children's. They spend a month there with the folks, and it's lucky because one of our past fellows is actually employed there. So it's kind of a nice full circle rotation. Our last rotation off-site is at our trauma location. We don't do trauma here, and so they have to rotate to our local trauma facility, which is called Valley Wise. It's down in downtown Phoenix, and it gives them an opportunity to see what trauma neurosurgery is like. So this is some pictures from our boot camp. Our boot camp is a week long, and it consists of lectures, hands-on applications, and it's kind of a nice way to get the fellows started off right. Each of our consultants, each of our residents, each of our residents and majority of our physician assistants and nurse practitioners, I'll give a lecture kind of showing hands-on technique, and kind of things to look for based on different practice things that come up in our daily life. Besides just our department, we had a collaboration with some of our orthopedic surgery fellows and chiefs to come over and kind of give some lectures based on, is it the hip or is it the back? And that's kind of a great thing to get started just from the very beginning. In conjunction with PCH, their pediatric neurosurgery fellow came over and did some lectures on cavernous malformations. And then as the hands-on portion went on, she was able to place some pedicle screws, place some EVDs, put the patient as in the skull, into pins and kind of practice with some shunt programming and different things. In addition to all of the rotations, we also do require that our fellows do presentations. And so these presentations are, sorry, my slides are being blurred. Okay, well, I'm just gonna leave it like this because I'm not sure where all the things went. But in addition to their rotations, they are required to give presentations every 2 weeks to Katie and myself. These are short PowerPoint presentations, 10 to 15 minutes, and it helps to reinforce the knowledge of what they've learned on their rotations. This is one of the ones that Serena did for us on spinal cord stimulation, reasons to do it, why we do it, what types of spinal cord stimulation, and it allows them to improve their presentation skills. In addition, each year, the fellows throughout Mayo Clinic, Arizona are invited to present during NPPA Grand Rounds. Usually there's about 3 sessions a year where the fellows are then split up and they give about 10 to 15-minute presentation, and it's usually case-based. It's on an interesting case they've come up with throughout their fellowship. Mayo also has Academic Excellence Day, where the fellows are encouraged, and please forgive the mess on that picture of my desk. The fellows are encouraged to participate in Academic Excellence Days. Again, these are case-based presentations based on things throughout their fellowship and skills. And lastly, Mayo Clinic Arizona actually sponsors a neurosurgery meeting every year, and our fellows are invited and are required to present a topic during the APP portion of the meeting, which is usually the very first day, and I'll talk about that a little bit more later as well.
Hey, JoDee, sorry to interrupt. I think your slides are stuck on the presentations slide.
Oh, there we go. Okay, now they're working.
Right.
I was like, why don't anything work? Okay, there we go. So a day in the life of our fellow. Rudy, things have changed a little bit since you were there with us, but we now do table rounds, which begin at 5:40 in the morning. And it's a group rounds that is done with our residents, our fellows, the APP that's on the inpatient service that day, and the post-call APP in addition to our fellow. And we go through all of the new consults that came the night before, any of the patients, and then we round together as a group. We start in the ICU, and then we go through progressive care, and then on to the med-surg floors. The fellows are given a patient. Usually it depends upon what rotation they're on. Early in their fellowship, they're required to do 1 to 2 in the morning before cases start. But as their fellowship progresses, they're given more and more responsibility. So they are required to write the progress note for the patient. If they happen to be on a certain attending service, they'll touch base with that attending to get the plan for the day for that patient. They're required to go see the patients in pre-op, make sure that the H&P is updated, that the patient's marked for surgery, that everything's ready to go, that they don't have any issues, ready to go. Usually most mornings we have a conference at 7 o'clock in the morning, and it varies from day to day, but each one is a neurosurgery based conference that allows them to get some additional education. And then our ORs start at 7:30 in the morning, and so they need to be ready and good to go. Postoperatively, we do post-op checks on all of our patients, and they are required to do those. And then they just need to give sign out on their surgical patients to the inpatient APP or a resident that's on call that night. And every night, the fellows are required to read for their cases the following day, so they are ready with questions and anatomy and different things based on the case that's coming up. All right, so some of the fun technology that we have here that our fellows are exposed to, we do have a Mazor robot. We have stealth technology, we have a ROSA, we have the Medtronic cranial robot. We do use surgical theater, and one of our doctors now does endoscopic spine cases, which is something new for us. And it's kind of an exciting new technology, and we do endoscopic cranial surgeries. So here is our surgical theater of a patient with a brain tumor. So in October of every year, we do host fellowship formal graduation. This is throughout the Mayo Clinic School of Health Sciences. Each fellow is recognized and given a certificate of completion, and that is held in October of each year. They just recently pushed it back. They were doing it in conjunction with the School of Health Sciences, but now the fellows get their own. So this is a small sampling of our team here at Mayo Clinic, Arizona. We have a combination of both physician assistants and nurse practitioners, all who participate in the education of our fellows, which is wonderful. Best part of the fellowship is our cute caring canines. This is Cooper, and this is Evelyn, and they are just some of the ones that we get to interact with here at Mayo Clinic, Arizona. So the other part of my life is for the Association of Neurosurgical Physician Assistants. So I currently serve as the president-elect of the ANSPA. And in June, I will become the president, and I will have a 2-year term. And the nice thing is that Mayo Clinic is actually partnered with ANSPA now. And hopefully between that partnership, we'll join a good collaboration for education for everyone. I joined the board a few years ago, serving as the director at large, and I'm currently both the secretary and the president-elect for a few short months until I take over as the president. So this is a great way to support your profession, get some CME. There is a QR code there. If anyone is interested in joining ANSPA, it's a great organization, and it is solely surgical based. Unfortunately, I know because we are an affiliate organization of the American Academy of Physician Assistants, Unfortunately, nurse practitioners cannot join ANSPA, but you are more than welcome to join any of our meetings. We do give CME credit for NPs as well as PAs, but because of the bylaws written in it, we are not able to give membership to nurse practitioners. I guess I talked really fast today because I don't have much else to share with you about the fellowship, but I'd just like to thank you, Dr. Bez, Dr. Rami, and Haley for the invitation to speak. And on behalf of Dr. Bendock and myself, I would love for you all to join us at the Ritz-Carlton at Dove Mountain in Marana, Arizona this year. We are hosting our annual meeting, our annual Advances and Innovations in Neurosurgery. It is April 3rd through the 5th. There is a QR code there for you to learn more about it. The first day of the meeting is an advanced practice provider course that is given by mostly APPs, and it's geared towards APPs. It's our topics this year include carotid disease. We're doing GLP-1s for anesthesia. We've got trauma lectures. We've got a variety of things. We've done ICU lectures in the past. So it's a great opportunity for you to come and network with some other advanced practice providers throughout the country who do specialize in neurology or neurosurgery. We do some neurology lectures as well. The general meeting also has, we also have hands-on portion. This year, we're going to do cranial plating, some suturing techniques, some OR positioning techniques, just to help kind of get everyone familiar and up to date.
Thank you, JoDee, for this overview of the PA Fellowship. We have a few questions. One is,
Absolutely.
tell me a little bit about the history of this program. How did it come about? Why did it start? What was the idea behind it? Why was there? And I mean, obviously, as you said, you're the first the PA Fellowship for neurosurgery. Who, not necessarily who, but how did the idea come about and mature to get to the point where you actually have a program that is accredited? And then obviously there's multiple steps for that.
Yes. So the program actually started, the actual paperwork started back in 2016. It takes about a year and a half before you get fully all of the School of Health Sciences sign off and accreditation and all of that. It came about because at the time, and I didn't work for Mayo at the time, they were having a difficult time recruiting. As you know, trained neurosurgery PAs are few and far between. And so they thought, what if we train our own? And Mayo actually has several physician assistant and nurse practitioner fellowships. So it was actually really, it was very helpful because you could kind of mirror some of the already established ones. There are steps that we had to go through. We have a Mayo Clinic School of Health Sciences, and that is where all of the fellowships are housed. And so there's an application process that is part of that. You have to get funding for it through the School of Health Sciences, and it has to go through an approval process. Once it's signed off by the dean, and then you can actually get everything established so you can start getting applications. The application process is about 6 months, like I said, and then you go through the process of interviewing. The first year, there were 2 applicants for the fellowship. And then the following year, we had about 3 or 4. And then the year of COVID, as you can imagine, we had about 8. And so every year kind of varies. And this last year, we had 3 really good applicants, and we selected Serena from there. But the nice thing is that because of the fellowship, it has been a really good retention and program for us. We actually hired our first graduate when she finished her fellowship. And then our second graduate, unfortunately, graduated during COVID period, and we were on a hiring freeze, but he actually took a position at the Children's Hospital and continues to be there. We've also hired our most Katie is actually not our most recent graduate, but the one before that, and she stayed on here with us. And our most recent graduate just went on to accept a position at Henry Ford Hospital in Detroit, working with our functional and chair, Dr. Ayer. So the reason we started that is because we needed, as part of a retention program, to hopefully help boost our APP staff.
Yeah, it seems like the APPs, obviously there's clearly a need for neurosurgical APPs. They clearly there's no shortage of position, and I think that one of the high signs of satisfaction is when you hire your own APP. That means you know that you know that these they're well trained, they do a good job. I want to ask a little bit more about the academic portion of the APP. Obviously, there's the hands-on course. There's the hands-on. You know, there's clearly a lot of hands-on. In terms of academic, do they have any specific requirements to you know in terms of writing papers or attending conferences, getting CMEs, or presenting themselves?
Yes, so we do biweekly presentations for Katie and myself that are done based on their current clinical rotation that they're on. And then they are invited to present at Mayo Clinic NPPA Grand Rounds. And they are also invited to participate in our yearly meeting, and they do give lectures during that. And then we also have APP education for our department, and it's on the fourth Thursday of the month. And the fellows are required to do at least 2 of those lectures throughout their fellowship. One is usually based on their lecture that they're going to give at our yearly meeting. Serena is going to do neuroradiology next month, as a matter of fact, in preparation for her presentation in April. And then on top of that, they are included in they have the opportunity to participate in any of the research. You know, we do have a residency, and all of our residents are required to do research and write papers. And so the fellows are also invited to participate. They aren't required at this time, but we've talked about requiring it. But in order to get all of that done in the year, it might be a little difficult, but because they don't get dedicated research time, we just don't have time for that. But on their own, they are invited to participate. As far as lectures, we do quite a few lectures at the beginning, and then each consultant, when they rotate with them, does a lot of hands-on teaching and lecturing at that time of how to improve not only their skill set, but also their clinical skill set of how to diagnose and manage a patient.
And you know, obviously this is not you've done a few years of this. Can you excuse me, can you talk a little bit about how some of the ways that you assess the success and the effectiveness of your program, and how have things changed since that first year and to now, and how things have moved along?
Yeah, it's
Uh,
hi, Dr. Bendock.
hi, Dr. Rami and
Oh, Dr.
APP
Bendak, how are
Winter.
you?
If I hate to impose, but I have to
Please,
run to go give my own grand rounds. May I make a comment?
Oh,
absolutely.
please.
Well, sorry I'm not on video, but good morning, everyone, to our dear sisters and brothers at GNI. Thank you for the honor of having our chief, our fellowship director, APP Winter, give a talk this morning. So I'm very grateful, Dr. Vez and Dr. Rami and the whole group. Number two, I want to make a comment that we would be delighted to partner on education. And number three, you know, any linkage between our groups would be a joy for us. And the fourth thing, I just want to make a comment that maybe APP Winter won't will be a little. She's self-effacing, so she may not say herself. In that the quality of fellows they're attracting is really phenomenal. I saw one of the questions was about, can you really attract somebody who's going to get paid less than if they took a job? And the answer is absolutely 100%, because they're so much more marketable, you know, after the fellowship. You know, they're increasingly sought after. In fact, our own strategy may be backfiring, where they're becoming so marketable that our whole goal was to train our own and retain. And now we're having to face competition from big academic institutions who want a piece of the pie, quote unquote, to be part of this. And so I just wanted to say what she won't say, in that the quality of applicants you're going to attract if you do this, it will not be a question. And hope to see everyone at Dove Mountain. I'm sorry I have to run, but I wanted to
Thank
thank
you.
the GNI for this illustrious honor. Thank you so much.
Thank you, Dr. Bendak. Thank you for joining.
Thanks, Dr. Brenda.
Perfect. That was a great answer, because Haley had actually, one of the questions was, how do we recruit? And when they know that they can be out in the work field getting paid sometimes double, some depending on the need, versus getting there. So that was a perfect answer.
Yeah.
So going back a little bit, following from the first year to currently now, how are you able to assess, the success, effectiveness, but most importantly, have you been able to tweak some things? Have you gotten some feedback about certain things that, maybe work better, some other things would work in a, better in a different way?
Yeah, absolutely. When I took over the fellowship a couple of years ago, I took a really good look at all of the rotations and the way that they were set up. And I realized there are some rotations that were at the end that would actually be better served if they were at the beginning, like neuroradiology. That's kind of a nice stepping stone to kind of help you prepare and get ready. So I took a really good look at the schedule and rearranged a lot of things so it makes a little more sense. So you get a good foundation before you actually start doing patient care. And that also helps because of the way credentialing works. Depending upon when their program graduates and when the fellowship starts, they may not be fully credentialed when they start. As a matter of fact, our current fellow graduated in September, took her boards, and then started in the second week of October. So she wasn't fully credentialed when she started. So she actually couldn't do patient care. So it actually worked out well that she was able to do some of the other rotations like neuroradiology, having boot camp, doing some inpatient time, or some time in the OR, just learning the instruments. Before she actually started taking care of patients when she was fully credentialed. So that kind of helped a little bit as well. And then based on feedback from, previous fellows, and actually from Katie, we've modified a lot of the rotations. We used to have the fellows spend an entire month with neurology, and that would be great, but it also took away from more of their surgical time. So we cut that rotation back for the coming year. It will be just 2 weeks. We used to have the fellow, based on feedback of what their interests are. Our last fellow was very interested in functional neurosurgery. So towards the end of her fellowship, we actually set her up to do a month with our functional neurosurgeon, Dr. Parker. And so we were able to tailor the fellowship to the fellow, which I think is something that's very important. Katie had a real big interest at the time. She wanted to do a rotation with Dr. Denomi, who is our neuro-ophthalmologist. And so we did a rotation with Dr. Denomi. So I think that's the biggest thing, is that to tailor the fellowship to the fellow. Not everybody likes, cavernous malformations and aneurysms and all that kind of thing. Some people really are more of a spine person and they really like spine. So to kind of tailor it, and I think that's been very important, and based on feedback, I think that's been very helpful. Yeah, Haley, to your point of how do you attract someone for a stipend amount that is quite a bit less than what they can make as a practicing PA. That is part of the reason why the fellowships have recently started increasing the stipend, is because the fellowships hospital-wide were having a hard time with recruitment, because people were like, well, we're needed, I can go work here. But, I think the fellowship, and I'm sure Katie can attest to, it is great. It's a year long of training where by the time you're done, you are a very sought after person. Our most recent graduate, Lexi, had 3 very good offers, one from Henry Ford, one from Beth Israel, and then Phoenix Children's also wanted to keep her. And, we wanted to keep her, but she wanted to go back home to Detroit. So, you know, the biggest thing is I think it's something that is very helpful for PAs as they come out. Neurosurgery isn't easy. And, you know, coming out straight out of school to learn how to do this, it takes a very special person. So I think, you know, having a fellowship allows someone to get comfortable before they are fully responsible.
Sure. And if I may add, that, as you said, you know, neurosurgery is not a general field, you know, so it's not something that you address too much during your years of a PA school. And it might be daunting for some people to say, well, I'm not gonna go do that. I don't know how to do it. I don't understand it. Why would I throw myself into that world? But you might have interest in it. And I think that's where the fellowships, and I think with time, as things get as these fellowships get more accepted in general, as more people start to request fellowship trained personnel, because everybody wants the best for their own patients. And I mean, while a PA out of school is trained to do, you know, what most PAs do, again, neurosurgery is not what most other fields are. You're not dealing just
Exactly.
with, you know, blood pressure, with all due respect to everybody, obviously, but it takes a little bit more of subspecialty care and training. So I think this is where a fellowship like that is key. Um,
Absolutely.
Obviously, you also have residents in your group. So how is the interaction between the PA fellow and the residents, as both are trainees and but both have different, obviously, demands, different career path, and two, how's the teaching of these APP fellows? Is it mostly driven by the neurosurgeons, the residents, the fellows, or by more their fellow APPs like you and, you know, this more senior APPs?
Yeah, so yes, we do have a residency. Our residency is very new. We have 5 residents right now. Miles is a 5th year, which is weird to me. But yeah, the actually our residents are great. And I usually and for those of you who aren't familiar, our residency is in a mentorship model, and that's kind of how I've also geared the fellowship. So our residents rotate with our consultants for a month at a time when they are on the neurosurgery service. So when I have gone through to schedule the fellows rotations, I purposely schedule them when there's not a resident on that consultant service, so that each one of them gets their own individual time with that consultant. I think that's really important. So not that it wouldn't be a big deal, but I think it's more important that they get that individualized time. As far as how they interact with each other, everybody's learning, and we all kind of hang out together. Our space is a little bit different than what we moved into our new space. And so we're all in kind of a big open area, and all of the residents and the APPs are all there together. And so we all work really well together. That was something that when we started our residency was very important. And we just sort of incorporated the residents into kind of the APP team. And so everybody kind of takes on a role of education, as far as who's teaching the residents, who's teaching the fellows. That's kind of a combination of everyone. Not only the consultants, but the APPs, the residents have something to do based on feedback from some of the residents. That's how I've incorporated a neuropathology rotation for the fellows. Miles, which is one of our 5th-year resident, came back and was like, JoDee, this would be great for your fellows, is to go spend some time with Dr. Donovan, who is our neuropathologist, and kind of see what gliomas look like under the microscope. And so that's a rotation that we've incorporated based on feedback from the residents, which I think has been great. Our trauma rotation has been modified from what it originally was to what it is now, based on feedback not only from our fellows, but also from the residents. They were doing the same location for their trauma. They just weren't getting a lot of trauma. So based on that, we've modified things based on their feedback as well. And then during our boot camp, the residents all participated in boot camp, and it was fun. I think it's kind of fun for our fellows because they are learning from people who are still learning as well. Or not that we're all not still learning, but that they're in training and they get an opportunity as they get further along in their residency and in their fellowship. We've had opportunities where our fellow is assisting Miles doing a case, and you know, he's teaching her, okay, here, let's get you exposed, let's do this. And I think it's been really great for him.
Good. And as these fellows go through the year, is there a, checkpoints from time to time, every, 3 months or after every rotation, and see, how their skills have evolved? And is there I don't want to say an exam, but is there at the end of the year fellowship, is there a set list of procedural skills that they need to know, that they should become proficient in before they graduate?
Yeah. So we check in, we usually do at least every month, if not every 2 weeks, we do a quick check-in with Katie and I, just kind of see how things are going. Is there anything that you're needing? At the end of, so I kind of have separated the rotations into like a spine rotation to begin with, and then a cranial rotation is after that. So we have them rotate with like 3 of our big spine doctors first. At the end of that time, I actually have a actual written test for them to kind of go through, just to reinforce knowledge. It doesn't count for anything, but it's more to reinforce their knowledge of things that they should know. Where do you place a pedicle screw? How do you, what is this? Is this a herniated disc, or do you have spinal stenosis, or do you have a combination of both? And then same thing at the end of the cranial rotations. Where do you put an EDD? What is Coker's point? What is Coker's point? So that they have that reinforced knowledge. And then at the end of their fellowship, they're given a final exam. Again, it's more to just reinforce knowledge of what they've learned throughout the year. And I think it's been really interesting the last couple of years to hear the feedback of, wow, okay, I had forgotten about that, but I remembered it based on my final exam. The tests themselves are open book, open note. I don't want them to be like punitive. I want them to be a learning opportunity, just so that if you missed something on the test, you can go back and go, okay, this is how I can improve on that. As far as skills-based, yes, we don't have true skills tests, but we do, as they progress through their fellowship, are they closing deep wounds? Are they closing, every kind of wound we have? Are they able to close? Are they the fastest? No, but nobody's going to be when you're first learning. But by the end of your fellowship, I expect them to be able to close a wound without assistance, and do it well. So we don't have specific tests for their actual surgical skills, but based on how their knowledge goes, if I see that early in their fellowship they're struggling, we're going to get them closing more wounds so that by the time they're done, they can completely close a surgical incision without any assistance.
How much time during their fellowship is spent bedside, patient care, notes, learning the day-to-day things of, changing medication, ordering Keppra, modifying things, knowing when an exam, when there's a red flag on an exam, that's just normal, expected, evolution of a neuro exam, versus in the OR operating. Is there a specific set of days where, okay, today you're in the OR, or is it just based on how the flow of things go?
So they are required to do morning rounds every day with our inpatient team. While they are on our service, they are required to come in and round every morning on their patients. So like, for example, Serena is currently on Dr. Bakshishan's service. He's one of our spine surgeons, our complex spine surgeons. So she comes in and she will round on Dr. Bakshishan's patients. She will do the exam, she will do the notes, she will update Dr. Bakshishan on here's what's happened overnight, here's what's going on, here's what I think we should do for this patient, and then follow up on those orders. Okay, I think it's time we can take the drain out. She'll go take the drain out. All of those kind of little things that so she's required to do that every day. Based on the rotation she's on, she'll have some clinic time as well. This week, Dr. Bakshishan was in clinic 2 days, so she will have 2 days of clinic with him this week. And then he has 2 days of OR, and then he has a research day. And so she's done 2 days of OR, and she'll do 2 days of clinic. And then on his research day, she did some more inpatient things. So it's kind of a nice balance that she gets a little bit of everything. As far as putting in orders, she admits patients, she'll discharge patients, she'll make medication changes if they need. And she does have dedicated weeks where she's just doing inpatient as well.
All right, and then from your perspective, what are you looking for in an applicant? Are there certain specific criteria? Is there certain specific, CV accomplishments, or are you looking for somebody who just graduated versus what if somebody's been in the field for 10 years, now they want to, change, but they can't find neurosurgery? What are you looking for, and are there specific criteria that are limit, say no, you're not getting in, or alternatively things that you look to accept them?
Yeah, we've had both. A majority of our applicants have been new graduates. That's just kind of the way of that it has happened. We've had people who have been doing something else and decided they want to do neurosurgery, and so they've applied. And the biggest thing for us is we want somebody who wants to learn. That's the big thing, is we want somebody who is very interested in neuroscience and like surgery. So that's something that we look for when we're looking through applications. People can be published all over. I don't care about that. I'm more interested in what their desire is. What do you want out of this fellowship? What are you hoping to accomplish? What do you want to do when you graduate with this fellowship? Those are the things that I look for personally. I look to see somebody who has done a rotation in neurosurgery, hopefully, during school, so you actually know what you're getting yourself into. So that's something that I really look forward to. And mostly I just want somebody who is a good fit for our program. We've had all sorts of people come through the program, and we can modify it and make it work. The biggest thing is this is a very busy year of your life, and we tell them, regular work weeks don't exist in the fellowship, so you need to be flexible. You need to know that your schedule may change. And like next week, you may be doing something different just based on the fact that, oh, something's come up and we need you here, or you need to be here. But the biggest thing is I try to make sure that our fellows are separate from our regular APP staff. In the way I mean is, the fellows they are still learners, and I try to reiterate that, they are still learners. So, you need to give them a little bit of grace if they forget or, do one little thing that is not exactly the way that we would do it. Talk to them, tell them, hey, you could probably do it a little bit different, or could you maybe help me do this? But make sure, they are still learners, and that's something that's very important to me.
All right. Well, I think we've come to the end of our questions. I don't see any more questions. Thank you, JoDee. Thank you very much for taking the time to talk to us about the your unique situation of having the PA fellowship. Hopefully, we will see more and more around the country. And I know we at GNI as well are working on establishing a PA fellowship. I think there is definitely a lot of benefit to that for the PAs, for the patients, and for the physicians as well. So again, thank you for sharing your knowledge, and hopefully we'll continue working together.
Wonderful. Well, thank you again. I appreciate it. And yeah, I've met with Haley, and we had a long conversation about some things, and I'm happy to help however I can.
All right. You have a good day.
You too. Thank you.